Yeah, my name is Dr. Percy Mahlati. I'm the Deputy Director General at the National Department of Health, responsible for hospital and tertiary health services, human resources for health, including nursing, health infrastructure, and overseeing strategic planning. Today we're having the first session of the G20 on human resources for health or health workforce, and is part of the G20 presidency activities of South Africa, as South Africa is chairing G20. So today we had two of three sessions. The first one was basically looking at the matter of ensuring comprehensive care, protection, and decent work for health workers. And we had three speakers there who really brought to light some of the challenges that are faced by health workers. It's actually more about looking at the conditions under which health workers work, what needs to be improved, what innovations need to be brought to place. I think of significance really was the input by Dr. Zolelwa Sfuma, who herself was upfront having contracted occupational disease, which is multi-drug resistance TB. And the poem that she rendered, really brought to light the challenges that not only health workers face, but also young people choosing a career, getting into a career, dealing with all the kinds of frustrations, that they face. The second session, for the afternoon was basically looking at how to increase investment, into the health workforce. And it basically looked at three areas. The first one was really around improving the economic system so that it could be able to accommodate and be in sync with the health systems, and specifically investment into the health workforce. The second part of that session was looking more deeply into the health workforce, emphasizing the need for the policies to be integrated, because in many countries all over the world, you find that there are various health policies that are not integrated, even including those of the health workforce. For example, it could be around conditions of service and being not in support, of the policies around the provision of health services, how programs are designed and implemented. And also the other one, very powerful, input by Advocate Maluleka from the Department of Women, Youth and People with Disabilities. That really focuses in detail on the challenges that are faced by women, bearing in mind that women in the health sector are more than 60%, of our health workforce. And what came out of the interventions mainly was the fact that it is very important to have collaborations. It is very important to always care for our health workforce and make sure that we're able to get the value out of the investment that would have been made. We will be continuing tomorrow with the G20 session on the health workforce, and the last part for tomorrow will be focusing specifically on migration, which is still a decades-long problem that we've had in the health sector.